Hey guys, Dr. Anthony Davis at the Spot Body Goal and Body Goal MD here in East Texas. We have a special guest today, Kay Bowman. Tell me again.
Account manager.
Account Manager for BioTE Hormone Method. They bring us the pellets, they bring us the Hormone Method. We're going to have a Q&A today, and I think it's about me, so stay tuned. So here we go. I think Kay has some questions for me, so let's go.
I do. In the theme of Father's Day, I wanted to come and ask you about your experience with BioTE, since you've heard all about mine for the last 15 years, the good, the bad, and the ugly, since you are my personal doctor. So I just wanted to come and find out about your experience with hormone therapy and then about pellets.
Yeah, I'm very passionate about hormone therapy, and I
Yes.
think it comes because of my own experience with hormones.
Right.
I would not be alive and well and feeling like I do without hormones.
Mm-hmm.
And I have been on them for a long time.
Yeah.
Long before almost all of my patients probably. Mm-hmm. When I was in college, I took it upon myself, because I was Superman, to help a refrigerator down at the back of my pickup truck. Well, it was about halfway down, and so I ran around and I got underneath it, and it just squished me. Ooh. And I felt a pop in my middle back. Ow, that was the worst pain I had had. I eventually had worse pain when I had a kidney stone, but at that time that was the worst pain I'd ever had. And the long story short, I found out that I had a compression fracture in my spine because my bones were kind of weak. Mm-hmm. And after the workup, they thought it was my low vitamin D. Mm-hmm. And at that time, no one was checking testosterone in a 20-year-old guy.
Right.
And so my vitamin D got fixed, which I felt better, but I didn't feel great. And my bones certainly didn't get stronger. Mm-hmm. So eventually they finally gave me a testosterone dose shot once a month. And literally I would feel good for 3 days. And to this day, I will tell all my patients, a testosterone shot will make you feel good for 3 days. Mm-hmm. And that's fine. You can do testosterone shots, but you're going to do them every 3.5 days. And so that's what it was. It was low T and low D. And you have to fix them both. And that's where my journey began.
Right. So with the shots, did you have that roller coaster effect that they talk about?
There's two reasons for that. One, no one is perfect.
True.
I don't know anyone who's like, and if they are that diligent about making sure their shots are perfect, they're so anal about everything else, they can't enjoy the benefits of the shots.
That's true.
So most of us would never be perfect. You get a day off here, a day off there, your prescription would run out, you'd wind up a week late. You're always playing catch up. Or if you did them every day, you would feel okay the first day, great the next day, kind of good the next day, bad the next day, and then it would cycle up again. And I would feel that dramatic effect, up and down, up and down.
Yeah. You felt like a woman.
You said that. I didn't say that.
No, I speak from experience. Okay, so talk about pellets. When were you introduced to pellets, and what was your
That's a funny story.
thought about that?
A rep like yourself had come in here to introduce me to pellets because I was kind of well known for hormones.
Right.
And the first time I heard the story, I was just inside. I was kind of laughing. I was thinking to myself, seriously, like that sounds expensive. That sounds silly. You're putting what under where? Mm-hmm. Are you crazy? Probably the same reaction a lot of people have.
Yeah.
And I did not do it. And so she very nicely came back every few months, and very nicely I would say thank you, and she would go out and she would come back. Right. And then, fast forward a year later, I had 3 of my patients who were perfectly controlled, in my opinion, on their hormone creams. They're perfect. Couldn't ask for more. Mm-hmm. Go get pellets. Come back and beg me to do their pellets for them because they wanted me to continue to be their doctor, but they did not want to give up their pellets.
Right.
So I was like, maybe there's something to that. But there were enough of them together that it made it worth my while to go look at the pellets and bring them into the practice. And the interesting thing is, the part of that was interesting is, as getting trained for pellets, I was able to get my pellets, risk-free. Here's you some pellets to try. And I was like, I'll see about these pellets. And it changed my life. Okay. I mean, I literally went from always feeling like my hormones were either up or down or kind of good or kind of bad to always good. Yeah. I didn't even know what that felt like. Yeah. So it was amazing. I was a believer after my first pelleting. And then the funny thing is, it seems like you could sell somebody pellets if you're a good salesman, right? You could really talk them into it, tell them how great they're going to feel. And that first pellet would be easy to sell.
Right.
If you weren't ethical at all, you could just be like, you're going to feel great. It's the best thing you ever did. It's something amazing. It's going to be life-changing. Here's your first pellets. And if they suck, no one's coming back. No one's going to come back for that second or that third or that fifth or that 10th one.
Right.
They always come back. Everyone comes back. In fact, they're coming back in the middle of the pandemic. They're not missing their appointments.
That was me.
You obviously know you're onto something when people are demanding their follow-up pellets.
Mm-hmm.
And I don't miss mine.
Good.
Because it's that important. It's that different.
Right. How long have you been on pellets?
I've been on pellets for right at 7 years.
Okay.
That's how long I've been putting them in, too.
Yeah.
So I've been a BioTE provider for 7 years. I've been putting them in that long. I have patients that have been on them that long, and I can't imagine them stopping.
No. I can't imagine stopping.
I can tell you when my next pellets are going in on my calendar. It's programmed to tell me when it comes.
Yeah.
Or you'll forget. You forget that you put the pellets in. Like, what were you doing 3.5 months ago? You don't know.
You don't know.
But that's the last time you had to think about your pellets if you're due.
Mm-hmm.
And a man, what was I doing 5 months ago? I don't know. What am I going to be doing 5 months from now? I don't know. Getting my pellets? That's all I know.
Yeah.
So you forget. It's so long in between pelleting, and you feel so good that whole time, you forget when your last thought about hormones was.
Right.
Well, how wonderful is that?
I know.
It's great.
And so for men, since we're talking about men, how often?
My experience is it's never less than 4 months.
Okay.
And those guys are really pushing it, I think.
Yeah.
It's never more than 6 months.
Mm-hmm.
So I find that 5 month mark seems to be right the perfect number.
Yeah.
You can tell if you go 5 months and 2 weeks.
Right.
If you come in a little early, I guess I pushed mine a little bit.
Mm-hmm.
I was thinking I would needed them. You know, you hear these myths, I think, about exercise wears them off and stuff. I just think you have to exercise a lot for that to be true.
Right.
And I went like 4 months, and then I went 4 months again. And I thought, maybe I should check my levels. And I was like 3,000.
Yeah.
Not where we want to be, not where I should be. And so I went and just let it all clear back out again. Now I go 5 months on the dot, and I'm always perfect.
Good.
I feel good, and my labs are always perfect. So I'm convinced it's 5 months.
Okay. Good. What other symptom relief have you experienced besides the bones and the
Well, I know
vitamin D level?
when my pellets are low, my workouts get hard. And what I mean by that is I don't ever have pain.
Yeah.
But when my hormones are low, every tendon starts hurting.
Right.
My body aches. I start sweating at night. I wake up and my pillow's a little damp. And I'm like, and my mood changes. My friends will text me and I'm like, I don't know if I want to answer that.
Yeah.
I don't know. I wouldn't call it depression, but I'm just off. I'm not bubbly and giddy and happy and looking forward to responding to something funny. I'm just not. And as long as I maintain my pellets, I'm my normal self. Mm-hmm. So my mood, my physical well-being, injuries, all those things start showing up. And that doesn't happen when my pellets are good. Or if it does, it's just a normal emotion. It's just a normal, it's appropriate to the situation.
Right. Appropriate. That's a good word. Okay. If you were to tell your friends about pellets, what would you say are the number, I don't know, several few benefits of pellets?
First off, all my friends are on pellets.
Good. I figured they were.
And it just, it kind of goes, it's like a wave. It goes across the board. I can spot a hormone deficient man walking in the door.
Really?
Yeah. They're just faking it. They don't have it. There's no bounce. There's no joy. Mm-hmm. Because usually I'm seeing them in the afternoon and they're already exhausted. Yeah. They don't have anything, the bell rings at work and they just go collapse in their recliner. They're done.
Yeah.
A guy that's well hormoned, he's happy when he comes in here no matter what time of day it is, and he's got plans that night.
True.
It's just the way it is. And so it's I would say to you, if you're tired in the afternoon, if you're a grumpy bear all the time, if you find no joy in anything, if everyone annoys you, if your friends bleep too loud, it's because your testosterone's off. You need to get that fixed. It's emotional mood first.
Yes.
Energy second. And everybody always thinks of testosterone. They think about sex. They think about sex hormones. They think about sexual performance. Yes, that's important, but that's the last thing to go.
Yeah.
That that's obviously so important to the survival of the human race. It's the last thing to fall off the list. Mm-hmm. If you're down there, you're so low, the rest of the stuff has been there for a long time.
Right.
So it's mood, energy, pain, sleep, sex. Mm-hmm. So most people have all that by the time they come rolling in here.
Right.
Man and woman, but we're talking about men.
That's true. We are talking about men. So talk about the protective benefits of pellets.
On your,
about the protective
on your body, on your heart, on your
body,
cancer.
on all of it.
You know, I guess that's another myth that I hear all the time is that testosterone causes cancer. Because we grew up with that mentality that it affects the prostate, so therefore it causes cancer. Well, actually, research has shown that low T is a much higher risk for cancer on the prostate because of a very important thing. The way we're designed, the hormones are supposed to work in concert. So estrogen is supposed to do good things to the body, but it needs testosterone to protect the negative. Same in men. We have a prostate gland that testosterone does make enlarge, but it doesn't make it cancerous. Cancer without testosterone present makes it turn cancerous. Estrogen makes it cancerous. Testosterone covers up the estrogen receptor that makes it turn into cancer. So they work together. And a lot of the times the estrogen stays up in men and women both. The testosterone crashes because it gets stolen, it gets borrowed by the cortisol, it gets taken away, we go into nesting mode and our testosterone goes away, and that estrogen stays normal. So that starts whipping that breast tissue and that prostate tissue and leads to the potential to get cancer. You have to have the testosterone on board to protect you. Imagine if your stress level without testosterone is a 9, and you feel so much better when your testosterone is normal, and now your stress level is a 2. Who's going to die first? The 9's going to die first because stress is deadly.
It is deadly.
And it has horrible effects on your body, on your mood, whether it's suicide or divorce or poor work performance, and then therefore the subsequent financial decline of that. It's all related to testosterone. I joke all the time. I'm dead serious. Divorce counselors should send people to me before they go into counseling, let me put their pellets in, then a month later go back and see if you need counseling.
Yeah.
You might not.
You might not.
So
true.
It's craziness.
Okay. Well, good. Well, thanks for talking with me today. Any Father's Day specials you want to talk about?
Yeah, I think so. I think for Father's Day to celebrate, it's a very important day. Normally we charge a $125 consult fee. Father's Day, all fathers who come in here, or men who come here during this time frame, we'll be happy to waive that consult fee. Whether you choose to get pellets or not, we'll be happy to help you. So call our clinic, 903-881-5165. That's Body Goal MD, the Davis Medical Group. We also have a full-service spa, the Spa Body Goal. That phone number is 903-PRO-SKIN, P-R-O-S-K-I-N. That's 776-7546. We can set pellets up across the board through all of those. You check out our website, bodygoalmd.com. You can see pellet therapy is on there. You can have a link to the BioTE website and get a lot more data and details from them.
Thank you.
Thank you.
Yeah.
Have a great day, guys. Thanks.
Bye.